Low back pain is the most common musculoskeletal condition in the United States and the world. And we hear a lot of scary words about that. A big one is degenerative disc disease. I have degenerative disc disease, I'm doomed, I'm going to have chronic back pain the rest of my life, I'm never going to feel better. The thing with degenerative disc disease, and that's actually a term that is no longer used in healthcare, but one that if you Google or look on WebMD, we see this, and it sounds very scary. And all that is normal effects of aging. We all have wrinkles on our face that get worse as we age. We don't need to go to the emergency room because we have chronic face pain. Our face is in terrible pain. It's just something that happens as we age. Our discs start to narrow and degenerate as we age. It only becomes an issue or pathological when we start to get pain. And you wake up one morning with back pain. We don't know why that happened, but we do know that your discs were in that same condition they were in the day before and the day before that. As our discs degenerate, that can cause the vertebrae to start to move a little bit more in our spine. And because of that, we can start to get what we call hypermobility or excessive movement in the spine. Over time, this can lead to arthritis progressing, our back getting very stiff, our muscles tightening or spasming to help protect against that excessive movement. We also know that the best thing to treat that is to strength train. So today, what we'll go over is 2 exercises that you can do to help strengthen your multifidus muscle, which is one that once your back starts hurting, the research shows that that muscle starts to atrophy, it gets weaker, it gets infiltrated and marbled with fatty tissue. So instead of being a big, strong, pure muscle, it starts getting weaker and not stabilizing your back as much. The first exercise is called the hip hinge. So this is a movement that's very important to master. What it does is it focuses a lot of the load from your back to your hip. What we want to do is we want to get a stick. You can use a broomstick or a hockey stick or a golf club. Anything around your house, a dowel is what we're using here, and we want that to be in contact with your tailbone, the middle of your back, and the back of your neck. And what you'll do is you'll bend forward. The key is you have to keep the stick in contact with those 3 points. That means that there's no way that you can bend through your low back because that stick will pop off of your tailbone. So you have to move with the axis of rotation through those hip muscles. You're forced to use those glute muscles, which are very strong, stronger than those muscles in your back as far as explosiveness, like if you're going to lift something up. And it keeps your back in its happy, neutral, resting position. So what we'll do here is we're going to keep that stick in contact with your spine in those 3 places, at the back of your head, in between your shoulder blade and at your tailbone. You're going to hinge forward, hold for about 5 seconds, and then go back to your resting position. We would repeat that 10 to 15 times, enough to where you start to be able to do it and feel that form is correct, and then you can remove the stick. And what you want to do is start incorporating that into your day-to-day life. The second exercise we'll do is an anti-rotational exercise, and we call this the Palloff press. So we're in that hip hinge position. Our feet are about shoulder width apart, core tight, slight knee bend, butt back. You're going to start with the band right in the middle of your chest at your sternum. You're going to push your arms straight out. As we do that, that lever arm will increase and it'll cause the band to want to pull you into rotation, and you're not going to let it. So you keep your hips pointed forward, you keep your shoulders pointed forward, and you push, pause for about 3 seconds with your arms fully extended, and then you bend them back, bringing it right back to your chest. You want to keep your hands right in the middle of your chest, so don't let it pull you to the right or to the left as you extend your arms. We would repeat this 10 to 15 times with a 3 to 5 second hold with your arms fully extended. Turn around and repeat on the other side.